Hi everyone, my name is Sarah Stream. I am ADAA 8th District Trustee, so I'm trustee for Iowa, Nebraska, Missouri, and Kansas. And I am going to be talking a little bit today about PPE and how you can optimize PPE according to CDC guidelines. I've seen a lot of talk on Facebook on the group about dental assistants that are out in their practice and they are frustrated with having to reuse some PPE that would normally be a single-use item. Unfortunately, with the situation that we're in right now, we have to make the best with what we're given. So, according to CDC, there are some PPE optimization strategies that they have listed. So I'm just going to kind of go over the CDC website and give you guys a few ideas about how to optimize your PPE. And, if you can't get certain things and you only have a very limited supply, how to make the best out of those. So the first thing I'm going to talk about is gowns. So I have here on the CDC website, this is just their PPE optimization strategy webpage. So this particular page talks about gowns. It talks a lot about crisis strategies and all of that. But I'm just going to kind of go through some highlights on this for you. So with gowns, as of right now, disposable gowns are hard to get. Unfortunately, the material that they make those out of, that's called melt blown, is very hard to source for manufacturers. So getting disposable gowns right now can be difficult. But if we optimize the gowns that we have, hopefully we can make those last and still stay protected. So this little paragraph right here talks about the extended use of isolation gowns. So extended use of single-use gowns can be a possibility right now. I know it's not ideal, but with the shortage that we're in, it may have to happen. So this just talks a little bit about reusing those single-use gowns and then changing them when they become visibly soiled. We also have the ability to use our cloth lab jackets like we have in the past, which is part of some OSHA standards for protecting yourself. You should have a long sleeve cloth covering, should cover every part of your body, be buttoned up to the neck, have wrist cuffs on it so you're covering your whole arm. Using those lab coats, the cloth lab coats, is still acceptable during this time. You just need to make sure that you are laundering them in office or getting some sort of laundry service to come pick them up. Do not take them home. And then, once again, changing them if they become visibly soiled. Or if you leave your work area. If you go to the break room to eat lunch, take off your lab coat. If you're leaving at the end of the day, don't take it with you. Just some standard things that we've been doing for a really long time. And now with everything that's happening, things are changing just a little bit. Another way to optimize disposable gowns is to prioritize those for procedures that we're doing that create aerosols. So you may use a cloth lab coat for things like an exam where there aren't any aerosols being created. It's still an acceptable OSHA covering. We're still covering our arms. We're still buttoned up to the neck, no exposed skin, but we're not creating any aerosols for that cloth lab coat. And then prioritizing the use for the disposable gowns for procedures that do create aerosols. So if you're doing something like a filling, a crown prep, something that's got a lot of spray and splatter, using that disposable lab gown for that procedure, and then doffing and disposing of it like you would, that is another way to prioritize gowns. We talked about this, if no gowns are available, using those cloth washable gowns and then having them laundered or laundered on site. Next I'm going to talk about optimizing supply of eye protection and face shields. So if we talk about eyewear, let's see, let's get down here. So prioritizing eyewear for procedures, the same as we would gowns. As dental assistants, we're used to wearing safety glasses with side shields. Most of the time, prescription glasses without side shields, like mine, are not acceptable. If you're wearing prescription glasses, you need to have side shields on. Now we're recommending face shields instead of just eyewear. But we can optimize the use of those face shields and eyewear as well. So prioritizing your face shields for those aerosol generating procedures will be important. Things like doing an exam, like I said before, you don't necessarily need the face shield because we're not generating spray and splatter like we would. So, wear your regular goggles, your regular safety glasses for those exams and non-aerosol procedures, and then wearing a face shield for your aerosol generating procedures can help to optimize the use of the face shields and make them last a little bit longer. Making sure you are cleaning your eyewear and face shields properly. So wiping the inside and the outside with warm soapy water when they become visibly soiled, you see spots and stuff on them. And then only wiping the outside of the goggles with that EPA registered disinfectant. We can do clean water or an alcohol wipe. Making sure everything fully air dries before you're putting it back on is important as well. If there's any residual bacteria that's left on that, it will live in that moisture on the goggles, so just let things air dry before you put them back on. Next, I'm going to talk about optimization of face masks. Let me get down to the bottom here. So traditionally, we have been instructed that face masks are single use only, and that still should be the case. But there are strategies for optimizing what face masks you do have. So if you are very, very short on face masks, you can consider wearing them for multiple patients, but that is only if you're very, very short on face masks. That would entail you donning a mask for one procedure, preferably a non-aerosol generating procedure if you have multiple exams that you're going back and forth to, and then leaving your mask on, not touching it, fully covering your face, just leave it there, and then going to your next exam. Don't touch your mask, making sure you're washing your hands between patients and donning and doffing gloves. This is not an ideal situation, but with the shortage on face masks, it may be something that your office has to do. Also, prioritizing those face masks for different procedures. We all know that, we have the option of a level 1, 2, or 3 mask. So using the level 1 masks for our non-aerosol generating procedures, such as those exams. Just wear your level 1 mask for those and save your level 3s for the aerosol generating procedures if you're not able to get those respirators. Next, I'm going to talk a little bit about the respirators, the N95s. So this website is a little bit more in depth. Okay, so with the N95 respirators, there has been a temporary suspension of annual fit testing for those. Now, normally an office would have to have a written respiratory protection plan, You would have to have a medical questionnaire and possibly an exam done by a medical professional. You would have to have an initial fit test to wear an N95 to practice in, and you would need to have somebody in your office to oversee that written protection plan, almost like an OSHA coordinator, but for a respiratory protection plan. So having those things in place and starting them now while this requirement is suspended temporarily can get you in where you need to be when that suspension is lifted. OSHA has a written respiratory protection plan template on their website where you can go in, copy and paste, add in your own policies, delete what you don't need. It's super easy. I made a template myself, just that was more dental based because the OSHA website is more geared toward a hospital situation. It took me less than an hour to copy and paste and move things around so it was good for dentistry. When this temporary suspension is lifted, if your office wants to keep using N95 respirators, all of this stuff has to happen in order for you to continue. So keep that in mind moving forward. You never know when that will be lifted. When we are looking at the suspension, when we're looking at the extended use of respirators, obviously discard them if they're visibly soiled. I know a lot of offices are wearing a level 1 over their respirator so they can extend the use of the respirator and wear those for multiple patients. There is also a strategy where you can put your respirator in a breathable package, so a brown paper bag, or I've seen some doing the little Tupperwares, and just let them sit for 5 days. So potentially every employee could have a Monday respirator, a Tuesday respirator. At the end of that Monday, you put it in a paper bag and you use it the next Monday. So that's just kind of an optimization strategy to make those respirators last, because just like masks and gowns, they're hard to come by right now. I hope that this video was helpful for everybody. Feel free to get on the CDC website. All of this stuff is on there, way more in depth than I went into. But, it's a struggle right now. Keep your head up, keep doing what you're doing, and hopefully we'll get through this all together. I hope you guys have a great day. Thanks.